we're back with the Unapologetic podcast. I'm Brandt Merritt, and I've got my co-host back, Jonathon. Good to have you back, man.
Yeah, it's good to be back. It was a long 6 weeks to be gone. I mean, in Fort Jackson, South Carolina, so I was working for the Army, and I wasn't roughing it, but being in a hotel suite for 6 weeks away from your family, missing basketball games, all the things here in the community I missed, work, team, our team, all the stuff. It was a long time. So 6 weeks doesn't sound that long, but
it is.
It is a long time. And when you're eating at the government dining facility, I'm come back and very thankful for the food here at SBU and Sodexo and all
our
the
tax
stuff.
dollars aren't going as much into the food as what
No,
we're saying.
Government contract, right? Take the lowest bidder. So
nice.
But yeah, glad to be back. Hit the ground running. I actually came in Friday, so I plane landed Thursday, and ended up coming to work Friday. And people are like, "Why would you do that?" I'm like, "Well, my kids are in school. My wife works part-time down here at Creator Design, so she was going into work. I'm going to sit at home with my dogs, or I can go in and see friends and have a cup of coffee." So I came back Friday, but then really hit the ground running Monday, and had a great week.
Been a full week.
Yeah, it's been a full week. Been a busy week, but a good week. And thankful to be back.
Well, thrilled you're here, and thrilled that we've got a special guest with us today, Mike Calhoun, CEO of Citizens Memorial Hospital. Mike, thanks for being with us today.
Yeah, thanks for having me on.
You're welcome.
Appreciate it.
Well, we've got kind of a range of things we can talk about. This is part of a little mini series that we've done of healthcare in Southwest Missouri. So I want to talk at some point just kind of big picture in the region, what CMH is doing and what you're seeing in that broad healthcare discussion. But also want to talk a lot about CMH specifically, and would love to just hear a little bit more about your background and what got you to the current role of leading a healthcare system in the region. So maybe just start there. Could you give us a little background about your story to your current role?
Yeah, so I've been at CMH for 25 years, actually, coming up this summer, and started with my first job at the hospital as a pharmacy technician. And my mom was a registered nurse, and I watched her as a kid put herself through school and sacrifice to provide for our family. And so healthcare was always something I thought, I wanted to enter into. And I saw that, and I thought the only thing that a man can do is either be a doctor or a pharmacist, and that was wrong, but that's how I looked at it.
Yeah.
And so I became a pharmacy tech to see if I liked being in healthcare. But then,
was it Kieran Bolivar, or were you at a different?
Yeah.
CMH?
So I was at St. John's, which is now Mercy.
Yep.
And then when I moved to SBU, I actually moved to CMH as a pharmacy technician. And then realized that wasn't for me. And so I, did some other things like courier, and I ended up running into our chief financial officer at the time.
Wow.
And he asked about my career path, and I told him I really didn't know. I actually was thinking about exiting. He asked me if I had ever thought about the business side of healthcare. I told him I don't really even know what that means. And so he asked me to be his intern while I was in school, and I was a sophomore at SBU. And I turned him down because I thought that intern meant free. And
Sometimes.
Yeah. So he asked me why I turned him down. I said, because I've got rent to pay. I was kind of on my own, and had to be able to have a job to pay rent, pay for my car, and all those things. And he said, well, I'll pay you whatever you're making on the courier route. So I got into administration as an intern. And then after I graduated from college, took several entry-level supervising jobs and ended up being a department director. And then for 12 years, I was the clinic administrator. So I oversaw all the physician clinics, worked with physician recruiting, building new physician practices, things like that. I did that for 12 years. When our CEO retired, I was asked to be the chief operating officer of our hospital and clinics. Did that for 2 years, 2020 and 2021. I went to the hospital during COVID. And then our second CEO, who was the original CFO, he retired. And then I became the third CEO of CMH in 2022 in January. And so now I'm in my 4th year there, and that's kind of a abbreviated story.
That gets us all the way to that point. And that it's interesting. You talk about coming in on the business side. I don't know that everyone always, to your point, understands that a healthcare system is not just doctors and nurses. I mean, there's a wide range of things that happen within the system.
Yeah, essentially any kind of job that you would see in, in a community is probably available in a hospital or a healthcare system. Whether it's financial or even more technical, plant facilities. There's a lot of different things that you can do in healthcare. Just about anything that you're studying in, there's probably a role in healthcare for you.
And so you were at SBU. What was your major here at SBU? And I guess even taking back a step, what got you to come here in the first place?
Yeah, business administration was my major. And when I was going through that shift from the sciences to business, I also was going through a faith journey time in my freshman year of college. I was actually going to Missouri State. It was SMS at the time, but I was studying sciences but was trying to figure out God's plan, for my life. And actually, there was a man I went to church with. His name was Rob Harris. He's still in town. Does kettle corn.
Rob. He was in my position before I came here, and then when he stepped away, that's when I ended up moving down here to take that position. So we've met a couple of times. I don't know him super well, but
good man. He invested in me whenever I was a young man, and he said, you really need to be in school, and we could find a place for you at SBU, and there were just things that he did to help me find a path to be able to make sure I finished my education. And so it also was very convenient working at the hospital like I was, so I could do everything here in Bolivar. And so that was really important to me. And, there's a lot about SBU I love. The other thing is, the educational environment can be not always conducive to learning, but I found at SBU, it was a place where they prioritized academics, and I didn't have a lot of distractions from learning. And so to me, that was my freshman year was tough. One of my freshman year of college, it just seemed like there were so many distractions on campus. My sophomore year here at SBU was really about studying and meeting good friends and focusing on your faith. There's a lot of things that I really appreciated about it, and it became really a good fit for me.
What years were you here? So you came your sophomore year. What year would that have been?
Yeah, so 19.
I don't want you to date yourself.
99 in the fall, and then I graduated in 2002.
Gotcha. Yeah,
and then stayed kind of in the region, I guess, as well. So what was it about even Bolivar in Southwest Missouri that's always been a draw and felt like home for you?
Yeah, well, I've got deep roots here. My mom's side of the family, had a century farm in Halfway, Missouri. That's where I went to high school. And then my dad's side of the family is from just north of Springfield. So this area is always an area that I've called home. And, when you first get out of school, you think I want to go somewhere. But if you travel a little bit, you realize this is really a great place to be full time. I really appreciate this area. I've got a lot of friendships and family. And so I think, it's just a place that I think is a great place to raise a family. It's a lot of things have drawn me to this, and I love the area.
Yeah, when we moved down here from Minneapolis, the Minneapolis area. You came from Florida, and I think we don't have the roots that you're talking about, but in terms of great place to raise a family, the friends, the connections, the community, it's just been a sweet time for my family being here in the Bolivar area. So really appreciate everything about this place.
Yeah, a lot of fast friends just in 3 years of meeting people in town, and when your kids are in school and they're making their friends and you become friends with their parents and we get plugged into church. It's been great.
Did you meet your wife in this area, SBU? What's that story like?
So my wife and I met. We actually were in the same church, and but I had taken a couple of years where I had gone. I'm also a minister, and so I was called to preach when I was 18. That was part of the faith journey I was talking about, that And so I actually moved away for a couple of years right after college. And then we reconnected. And when I came back to this area, we began dating, we got married, and now she's also got even more deep roots in this area. She's a Roberts, and so you've heard.
Okay. Yeah.
So I tease that by marriage I'm related to half Polk County. So, but her family is all here on both sides, and so we have we're close to family, and raising our kids around their grandparents, and it's just really a nice.
How many kids do you have?
Experience. So we've got three. I've got a 15-year-old boy, a 13-year-old girl, and a 7-year-old girl.
Mm-hmm. That's awesome. Fun ages. Awesome. That's kind of about where we're at.
Yeah.
8th grade. Your girl, 13-year-old girl, she's in 8th grade or freshman?
Grade.
7th grade. Okay.
My 15-year-old is a freshman.
Okay.
And he's plays sports a lot, and and Bolivar schools for all of them, and then
so we show up at the middle school in the mornings to do the drop-off line for my youngest boy is 8th grader. So there we are in the drop-off line at the middle school.
We know all about it.
Yeah, that's right.
Yeah. My girls, they like dance and cheer and play the piano, and so it's just a full life. It really is.
Yeah. That's great. And you still are in ministry, active, I believe, serving around here too. So how is that? It's just an interesting kind of balance of you're called to ministry, but I'm assuming called also into healthcare and as sort of another form of ministry. How do you maybe balance those through your career?
Yeah, I feel like my call to preach and pastor was more direct calling. I think healthcare, I wouldn't have said that it was a calling maybe in the beginning stages. I worked and I enjoyed working in the healthcare environment, but over time I really grew a passion for being able to do what we're doing and what an impact it makes on our community and the impact the care we provide, makes on other people's lives. And so, but I've always felt like the need to serve in the church was still there and burns in my heart. And so I've just continued that, and it's somewhat difficult to balance those things. But felt like I've been given grace to be able to do it.
That's great.
So 25 years in the healthcare system, what have been some of the biggest changes that you've seen? I mean, I just can't imagine COVID being sort of a major disruption, but even over 25 years, there's been a lot of other changes. What's been some of the major moments through that?
Yeah, I mean, it's really hard to single out. I think maybe the big picture about what's changed is just that we've continued to add services and grow. And, as a part of that growth a lot in my time in the clinic system, directing physician clinics, physician recruitment's a lot of how you grow. Yeah. So as we brought on new physicians that brought new specialties and new services to CMH and the Bolivar and surrounding community, well, then you need all of the support structure around that. And so it's just been continual growth since I've worked there. And so with that brings, challenges, opportunities. And so when I first got to CMH, it was a lot smaller. You knew everyone that worked there. And now we have 2,500 employees across, 6 or 7 counties. And so it's hard to be able to connect to all the places that you'd like to. I work really hard at that and try to make sure I'm in all the facilities at some point to meet the frontline staff, because they're really driving everything that we do. Right. That gets challenging as you get bigger, and we're bigger than a lot of people think that we are because we've continued to grow. The hospital's grown, but the healthcare system, the outpatient, the home care, the long-term care that we do, that's grown a lot too. And it's just, that's probably been the biggest change. And so a lot of what we're focused on right now is how do we keep that personal touch where people still come in the door, wherever they go, they feel like they're treated like a person, that we value them, not a number. And we keep that personal connection, which we've been known for. But as we grow, how do we elevate the quality of the care that we're providing so that when you look at outcomes, you say, well, it's really the safest place to get care. It's the highest quality place. That's the balance I'm working on right now. And I think that's always been a focus we've had. But as we've grown, I think we've had to figure out how to do that with more people and more services, more specialties.
When you say grown, and just this is my ignorance, the CMH system, how many does it span outside of Polk County? How far is the reach for the CMH systems?
Yeah, so think about our service area like this. So I-44 is kind of like the southern border. The western border, let's just say everything on this side of Nevada. The northern, anything on this side of Clinton. If you look to the east, anything this side of Lebanon. So if you drew a circle around that, that's about 130, 140,000 people that live in those in that circle. And then we've got 34 physician clinics. We've got 6 long-term care facilities. We have a residential care facility. We've got a hospital. We've got a outpatient surgical center. So, all those things have grown over time. And that's been our service area for a long time, but we're probably capturing more of the care in that service area now than we ever have, and that's what's made CMH grow. And that population's grown a little bit in that area, but I think more we've been providing services that cause people to say, "Oh, I can go there instead of, Springfield or Kansas City." If the drive is similar, they can come to us, and probably our advantage is that they come and it's not so big and they can know people, and that's been kind of a competitive advantage that we've had. But I think what I've really put a focus on, I want the competitive advantages is that even if you, even if it was further to go to CMH, the quality's so good
You choose
choose that first.
Yeah.
Right. And that we do have people coming from further away now. And
So when you think CMH, and it's helpful for me to broaden, don't think CMH is the one hospital building over here in the middle of Bolivar. It serves a whole region.
It does. It serves a region. And early on, we focused on getting primary care physicians out in these more rural communities where people can see a doctor in close to home for their general primary care. And then when they need more, they can be referred to Bolivar. And then that's how the Bolivar services have grown. And so those 34 physician clinics that we have, several of those physician clinics are out in rural communities with primary care physicians. And also a focus we've had is how do we make sure we have good after-hour weekend care out in those communities. So you'll see we have walk-in clinic models that are 7 days a week. We're there into the evening. Well, that was strategic, so you don't have to go to an ER for something that's non-emergent.
Yeah.
And now our ER is overflowing, but we've been able to stave that off a little bit over the years by having good access out in these communities where people don't have to go to the ER at night or on the weekends. But even now that our ERs now is kind of too full, and the expansion's coming at exactly the right time.
Yeah, for sure. And just to that point, driving around Bolivar, I mean, I always feel like once a month I'm surprised, like, oh, I didn't know CMH had a building there. I still discover you guys have, even just in Bolivar, a footprint of services that is well beyond what you would typically think of with just a hospital. So it is impressive on that end. And it's interesting you say that, because I went on the growth side, because I was thinking part of the growth is the population growth, but you've seen it more as people choosing to stay a little bit closer, contributing to growth of services by choice, not necessarily just having to meet the need.
Right.
Because the need has grown, but maybe not as much as I was thinking.
Yeah, and it has grown. But, now, like, one of the things we measure is, when a physician sends to another physician for a referral, how often does that stay in our services?
Yeah.
And the answer to that is somewhere around 75 to 80% now. That's pretty significant.
Sounds good. Yeah.
And so there were days when that was more like 40 or 50%. And so so that gives me an indicator of we've got more specialists available, so they can send them to a CMH specialist.
So cardiology, dermatology, like all those things. Those
subspecialties that might perform a surgery, or they might you need an expert opinion on a particular disease state. Those referrals from primary care, most of them are able to stay at CMH without having to go outside of our network.
Yeah.
And I think that as we continue to look at where people need to go outside, that's where we look at our recruitment plan and say, how do we bring those specialists here so that they don't need to go outside, that we can do that here close to where they live.
Sure.
Yeah. Well, workforce development was something I was really interested to talk to you about, because that plays into your part about recruiting doctors. We have a vested interest on the SBU side because we train nurses, radiography, physical therapy, and are always looking at what are the other needs in the area that we could help train and credential. And you guys are always looking for seats to fill. I was actually going through the job open site just to get a sense of the kind of positions you're looking for, and I felt like every other position was a nursing opening. Like it's almost like we can't, between all the schools in the area, we can't produce enough nurses for what all the healthcare needs are in the region. So just workforce development broadly, how have maybe your strategies changed? How are you currently working to fill those needs? And it's just I'm sure a constant thing on your mind.
Yeah, and I think that probably is one of the greatest challenges that we're all facing in our economy. But that's certainly true in healthcare, especially as the baby boomer generation reaches to an age where they need more hospitalizations, long-term care, things like that. Where are we going to get the workers to be able to be at the bedside to care for them? And that can't be replaced by technology. There are some things that might be able to be, but that care at the bedside has to be in-person care for the most part. And so, our focus really has been, we need to develop more connections with young people further upstream. So, a lot of the conversations we have right now is that as early as middle school, we need to be having conversations with kids about what a career in healthcare looks like, and finding individuals that think they might want to go into healthcare and getting them on-site opportunities to see what it's like. And then how can we have programs that we can clearly define, here's your path to that field that you think would be something that you're interested in, so that by the time that they're out of high school, they already know what they're going to be doing for their career, and they already have a path to get there, and it ends at
They've been
CMH.
trained, they know the people.
They've trained there. Ideally, it would end at CMH, but really, we have to think maybe bigger than that and say, well, maybe you want to live in Springfield. Okay, well, if that's where you want to live, then we can train. You can work there. But if you want to stay, you don't have to give anything up to stay. And I think we need to get, your wages are going to be equivalent. Your cost of education is going to be equivalent, whether you stay in Bolivar or you go to Springfield, so that, in this service area that I talked about where there's 130,000 people, there's a lot of schools in those communities. And how are we doing it? Reaching into those schools and showing people that there could be a career that would be a really nice career path for them as early as middle school. And that's the kind of thing we're going to have to do. We're going to have to develop our workforce to get them thinking about being in healthcare. And that's the only way we're going to be able to satisfy this. I mean, there's some things we might be able to do with technology to make the workforce more efficient.
Yeah.
But we need more people in healthcare.
Yeah. Where have you seen maybe interest shifting? Are there certain positions that have become easier to fulfill maybe than they used to be? And are there ones that have become harder?
Well, I really do think that, the pandemic made people think about, exiting healthcare because it was such a challenging time. I think we've overcome that, and there's more excitement now about people entering into nursing and the healthcare workforce. So I think that we've turned that just a little bit. But now it's just getting enough to satisfy the need for the healthcare that we're providing, because we're not only are there people needing more healthcare, but then we're growing our services. So we're just continuing we can't get enough employees, and I think that's the challenge we have. But I feel like CMH is an attractive place to work, and more so all the time. and I think our expansion is going to help with that too.
Yeah.
And so I won't say that there's any one area that's easier now, but I do feel like that we're making some gains. We're not relying quite as much on temporary staffing.
Yeah.
We're filling our positions more. We feel like we're in a better place than we were, but it is our biggest worry about how do we find people as we continue to grow.
In terms of healthcare and filling the spots that are open in the healthcare world, what's the turnover rate? Is this a profession people get in and get out of? And
Yeah.
you're constantly having to replace people, or I don't know what that looks like.
It kind of depends on the role.
Yeah.
So obviously your frontline roles like, nutritional services, environmental services, some of those entry level, not what we call non-skilled. In other words, you don't have to have a degree in order to go into it. Their turnover rates are quite a bit higher, because usually they use those jobs as a platform for the next thing,
right?
Which is okay. And that's something that we really want to see, is that people that get in the front lines, that they use that to get in the workforce and decide what's their path.
Yeah.
You get into more skilled or trained positions, nurses and techs that require certification and training. It's a lot lower. You might say 10, 12, 14%, on some of those roles, which seems like a lot, but there's a lot of people in the workforce, and they are shifting in different settings. And so I'd say that's a good estimation, but
sure.
So part shameless plug maybe, but also part chance for you to, see if maybe things that us and other colleges could do better. So an SBU student that comes to CMH, how maybe do they perform different, or maybe since we talked about the faith component, do you see that in the workforce when a student from SBU or another faith-based school gets in the workforce? Are they performing at a high level, and do you enjoy, I'm assuming, getting SBU grads to come to CMH? And then sort of on the flip side, what are some things that schools maybe could do better, that you guys are working to try to improve in the training and the education process within the region?
Yeah. So SBU grads, really positive, their work, their values, really strong. All I hear is really positive feedback about the nursing students that we have on our campus.
Yeah.
And I see them at places like orientation. They're always considerate. They're kind. They seem excited about the work that they're doing. And so I've got a really positive view of the SBU nursing program. And other disciplines that you're training in.
Right.
I think you all do a really fine job.
Yeah.
I think probably the thing that for us would be most helpful is the more that we can get local people that want to stay here long term to choose SBU. I think that's the challenge. And I know SBU has a draw from a wider map than we do.
Right.
You're looking at all over the nation, people coming to SBU, and our workforce primarily is local,
Right.
Except for roles like physicians who move here and things like that. Most of your nursing, most of your techs, they come from people who want to settle down and stay here long term. So that's why we're thinking, how do we get in the local high schools, middle schools, places where people are from here, get them thinking about healthcare. And then how do we get more education offerings here in this area where they don't have to go somewhere for their education? How do we make that more affordable for them?
Right.
Because a lot of times that's the sticking point, is that maybe they're the first time going to college and the money scares them away. So how do we partner even with education institutions to take some of that financial burden away?
Yeah.
With the return, those students then come into our setting.
Yeah, there's a real ROI for health systems to partner. And it is a partnership thing. We are trying to find things that are actually desirable, have good outcomes and pathways for high school students. And then healthcare systems like CMH are looking to fill it. So there really is like this three-headed, school systems at the high school level, colleges, and CMH to work together to find ways to create those pathways.
Yeah. And I think, the more that we can have the education partners and the workforce partners, sitting down together and coming up with solutions and pipelines for, healthcare is what I'm most concerned about, but really for the strengthening of the community in general.
Yeah.
I think, sometimes it's been seen, like said, and I think this is errant, but like, 4-year degrees aren't for workforce readiness. Well, I'd like to push back against that. I think there are some disciplines where we really need the 4-year degree.
Right.
And we'd be talking earlier about then how do we get you ready for your career as a part of your 4-year degree by working with other institutions for that. Sometimes it is a 2-year degree. Sometimes it is a technical degree. But I think no matter what the degree is, I think we need to be thinking about how do we get that young person to see how that could fit into the workforce in a way that really allows them to contribute strongly in society. I think that's an opportunity for us to continue to work on.
Yeah, absolutely. And we've had a big emphasis since we got here the last 3 years, even from Dr. Melson on down, of trying to improve that local pipeline, because it even suffered for us a little bit, when you start to go back to the pandemic. And 4 or 5 years ago, I'm really encouraged this fall, we're triple the number of admitted students from Bolivar High School, just specifically in our pipeline for next fall that are seriously considering us. And so, those at bats then help create more at bats to work with CMH or other businesses around here to say, okay, we are getting more students to stay local, see the opportunity. And we've done some things. We've offered some specific additional financial aid programs to help meet that gap on the cost side that you talked about. So it is really causing all of us to sit and think and be creative of how can we improve, that ability for students to stay who want to.
Yeah. Also, you're just thinking about from SPU's perspective, like how do we, some of these maybe students come from some other community further away. How do we integrate them into the community so that they say, this is a place I'd like to stay.
Right.
Maybe I don't have roots here, first generation, but that really makes the community better when you have people that went to SPU that decide they want to stay here in this community. It makes Bolivar better.
Yeah.
And, I just think the more that we can continue to work together, strengthen the community, makes everything better.
Yeah, win-win. Better Bolivar is better for CMH, better for SBU, and vice versa all around. Yep, absolutely. Well, we've kind of hinted at this expansion a couple of different times. I mean, I'm just going to give you the floor. I mean, what is it? What's all the things you can do with it that maybe you couldn't do before? I mean, it's big when we drive by it. So kind of what's on the inside that's going to make a big difference for you guys?
Yeah, I could talk for a really long time about this, but I'll try to be.
Well, you've got a few minutes.
Succinct here. But this is a historic time for CMH and for the Bolivar community, much like it was in the very beginning when Bolivar launched its first hospital in 1982. There was a lot of community support, a lot of need for the building of a hospital. The goal was to attract physicians. The goal was to be able to have health care that you could access close for these rural communities. This new expansion is essentially building a new hospital in Bolivar that's at today's standards and is made and ready for the future. Wow. So, as I look at this is one of those things that is a once in 50 years proposition that we're doing. And so we basically built everything new that you would see as an inpatient if you went to the hospital at CMH. And we focused for so long on outpatient growth and adding clinics, adding outpatient opportunities, because that's where a lot of healthcare is going.
Yeah.
But it was really past due for us to go back to the core of the hospital and get it up to today's standards. We're in a facility that's been modified 6 or 7 times since 1982.
Yeah.
And we just, added on branches and wings and everything. But it wasn't really built with where we're at right now in mind. And so that's what this new hospital is. And so if you went, you would see that everything is up, modern, state of the art, whether it's the furnishings, the equipment, the technology. So some of the things that we get from this new hospital, first of all, ER access. So right now we have 12 beds in our current ER. The new ER, when we move in, has 29 beds.
Wow.
Well, that's a change. Or we've got a fast track area. We've got behavioral health safe rooms. All the things that we deal with right now, we've accommodated for and can better serve our patients when they come to the ER and they have an emergency. CMH is, a level 3 trauma center, a stroke center, a STEMI center. So cardiac, stroke, or trauma ambulances, unless it's really serious, oftentimes we'll bring to CMH. So we need to be prepared in our facilities to care for patients. I feel like that this hospital better represents the care that we're currently providing than the current building that we're in. It looks like a small, rural, critical access hospital, but we have full-time hospitalists, ER physicians 24/7, specialists that round in the hospital. We're a lot more capable than people think that we are. And I think the new hospital more accurately reflects what we do inside.
Yeah, I can see that.
That's good.
So the ER grows. We have a new dining area, cafeteria, and we're kind of known for our food, honestly.
We
do a
learned
good
that
job.
pretty quick. We
Yeah.
moved 3 years ago.
3 years
we
ago,
talked to
that's
people
where you
like,
went.
hey, where do you want to
Where
go
you
after
going?
church? Oh, the hospital.
Yeah.
And we're like, what?
Okay.
Yeah.
And it was very
It was
good food.
Yeah, well, that's getting elevated in our new
Yeah.
area. It's going to be a restaurant-style dining, and it'll be a nice facility. On the second floor, we've got med surge, which is where your standard inpatient is, medical surgical unit. All private rooms is the key there. We have 28 all private rooms, and that's something we don't offer right now. We'll actually be the only hospital in the region that has all private inpatient rooms.
Oh, wow.
And then the other side of the second floor is the intensive care unit. We currently have 8 intensive care beds in our facility. We'll have 16 in the new facility. And
It's almost doubling across the board or more of what you guys were able to do before.
the rooms in the ICU. And so this kind of follows the trend of healthcare. You're seeing an increase in ER, increase in ICU and monitored beds, because a lot of your standard medical surgical inpatients, they're trying to handle on an outpatient basis now and not in the hospital. So that hasn't grown as much, but we've made it more private, a better situation for those that are in the hospital for a couple days. And then our third floor, and the ICU rooms are all beautiful. I mean, they're appropriately sized, have all the monitoring equipment.
Well, and lots of glass. I mean, just the natural light that you guys
Natural
were
light.
intentional with it. Yeah.
Yep. Third floor is our birthplace. So we currently have 6 labor and delivery recovery rooms, which we do everything in one room when you have a baby at CMH. So, some people have experienced you have your delivery.
Yeah, we had triage, delivery, and then mother baby.
Yeah.
And,
You come into CMH, you go in one room, you stay there until you're ready to go home.
Okay.
So we have 6 currently. In our new facility, when we move in, we'll have 9. And then the C-section suites on the third floor with the birthplace and the nursery, it's all there together. Okay. So similar to that, if you have a C-section, you really don't move very far to then go to your room because you're all on the same floor there. And so it just creates comfort and convenience for the patients. And so then our other side of our third floor is shell space, which was intentional because we know we're going to grow. And I don't think we quite know what we're going to need as we grow. And so that gives us the ability to build that out on the third floor and quite a bit of space there for that.
Amazing.
So that's our what we're opening this month and next month. And then we start immediately on phase 2, which is 2 new state-of-the-art cath labs, a new laboratory that was designed and built for the way our system is now, so we can process test results across our system at this one main hub with modern technology, automation, the way it was really. If we started today, it's the way you would design a lab, right? New surgical area with additional ORs, additional recovery rooms, the cath lab. We have 2 cath labs, and then we've got additional cardiology recovery space. So basically revamping all of our inpatient services. We've got new CT scanning equipment for the ER. Really excited about that. All of this just provides more access for people in a more comfortable space. And one of the things that we were showing off on our tour last weekend was that not only did we update the space, but we updated all the technology related to the space. So we put all of the latest technology to help with patient education, documentation assistance, scan and go, swipe and go with your badge for getting computer access. Everything was updated to today's standards to make it more efficient for our staff and more convenient for our patients. And so they're going to notice not only a change in what's around them, but they're going to notice the way that we deliver care. We've given more tools to our people to be able to do a better job. So this is a big deal. I mean, you can tell I'm excited about it because it really is going to be not just an additional facility. It's going to be a game changer for how we provide healthcare right here in this area. And it really, people will say, it's nicer there. The quality's better. I feel safe and I feel like they know me. See, those are the things I want people to feel when they think about CMH, whatever door they enter into, that they feel cared for, that they feel like that they're safe in our care, and that they're going to be able to go home to their families and recover. Yeah. And they couldn't think of how it could be better. That's what's on our mind every day.
That's awesome.
So beyond what it means for community, I'm assuming for your staff, it's also been probably a huge lift for them to feel different about the place they walk into potentially.
Absolutely. They are so excited. Yeah, that's an understatement. The people are just anxiously awaiting, so happy to think that they're going to be in their new space. And I can't wait for them to get into it. I'm glad for the energy I feel for the team. When we first started building, someone said to me in a forum that we did, they said, well, why would you build this hospital? How are you going to staff it? I said, that's why we're building it.
Yeah.
Because people will want to work here. And we're already seeing that in physician recruitment, more physicians are joining us. We're seeing that in our recruitment of staff efforts. More people are turning our way and saying, I think I'd like to go see that new hospital. I want to work there. I've heard it's a good place to work. So I think when we think about workforce, some of this is the strategy for workforce is put a facility here that people are attracted to.
Sure. I want to be part of that.
That's right.
Yeah.
And if you can have, your quality metrics to be best in class, and it's a new facility, and it's a great place to work. We've got a lot of initiatives right now making sure that more of the decisions made about how we provide care are done closer to the bedside. Well, we've applied for some acknowledgement of that and recognition of that through some of our efforts in a program that's kind of like Magnet. When that comes out here pretty soon, I think all those things are going to say to someone that's a young person that's thinking about going to healthcare, why would I want to go somewhere else?
Yeah.
And so that's really what we're trying to do, because that's how we're going to be able to be successful as we move forward.
It's good.
Sounds like our campus master plan vision.
Yeah.
It's like we were just talking the other day, we had an updated meeting on it and reiterated the phrase we said a few times, that a facility should facilitate something. And, there's a purpose and design to it. And that's what you guys have accomplished there, and what we would hope to do on campus here too.
Yeah. I'm super excited about what I see over there, and just it makes being here that much better. So everything we talked about earlier, the roots, the community itself, the joy my family's felt being here, but then to see medical access and that program over there grow has just been icing on the cake.
Yeah.
Yeah, I appreciate that. And I think we really in Southwest Missouri are very blessed to have access to the healthcare resources that we do, not just in Bolivar, but in Springfield. And we work with both systems and often transfer people to Springfield when it elevates past what we're able to care for here. And, I think, healthcare elevation across the region, education resource elevation across the region, I think that makes the backbone for being able to be a great place to live, to raise a family, to work and play. And I think we play a pivotal role in the health of our communities.
Yeah, absolutely.
Well, that's probably a good place to end it. Mike, thankful for your leadership and all that's happening at CMH. And, I think speaking for my area on the enrollment side, and I think for the whole university, we're looking forward to continuing to find ways that we can work closely with CMH and do what you were just talking about of elevating the whole region.
Yeah, thankful for partnerships already. I mean, we have the ability to tell parents when they show up here and we're doing preview days or talking to students. CMH has a clinic on campus, right?
Yeah.
And so over here in the nurse's office, Nurse Becky, everybody loves her.
Yeah, they do.
Nobody. Every time I renegotiate the contract every year, is she coming back? Is she coming back? And that's a blessing to us that we can say right over here on campus, not far from your dorm, you can go see a CMH nurse, and there's telehealth options. And so we're thankful for everything you've provided for us here.
Yeah, well, it's a pleasure to work with SPU. We appreciate what you do for this community, and just really appreciate you having me on today to tell the
We
story.
didn't even talk about Kentucky basketball, but I had to at least let people know that
we didn't get to talk about it.
Talk about
Well,
it.
thank you. There you go. Now we did.
Yeah.
That's all right.
Yeah.
Well, thanks everyone for listening to this episode, and thank you again, Mike, for all that you're doing. And we will see you on the next episode. And Jonathan's back. We're back to full strength.
100%. Let's
All
go.
right, let's go.
All right, thank you.